1:32. This is perfect. Good afternoon. Thank you for being with us today. This is the Health and Government Operations Committee. The chairman is Chairman Pendergrass. We actually have 7 bills on the agenda today. There's no favorable with amendment and no unfavorable. So you will get 2 minutes to testify, and then the delegates will ask questions of you. Please stay while they ask their questions. Today, they're actually will be presented by the departments, and we're going to start with Senate Bill 186. Susana and Richard will let you know in the chat room the bills that are next, but the order is as follows: Senate Bill 186, Senate Bill 168, Senate Bill 196, Senate Bill 174, Senate Bill 183, Senate Bill 192, and Senate Bill 144. And these are bills that were not crossed, and we're going to start with Senate Bill 186. We're going to call on Heather Chack, and this is the Maryland AIDS Drugs Assistance Program Fund. Good afternoon. How are you, Ms. Chack?
Good afternoon, Vice Chairman Peña-Melnick. Thank you so much for having me here today. Good afternoon to Chair Pendergrass and the rest of the committee members as well. My name is Heather Chack. I am the Director of Governmental Affairs at the Maryland Department of Health. Thank you all for the opportunity to testify in support of Senate Bill 186 on behalf of the department. I'm also joined by my colleague, Peter DiMartino. He's the Director of the Infectious Disease Prevention and Health Services Bureau, who's available for any questions the committee may have. Before I get started into what the bill seeks to do, I just want to provide some really brief background on what the Maryland AIDS Drug Assistance Program, or MADAP, is. And MADAP ensures that people living with HIV or AIDS in Maryland have access to the medication they need to stay happy. Happy and healthy. The program pays for medications for eligible clients with no insurance and helps clients with insurance by paying for eligible copay and deductible costs so they can get their medication. The program currently serves on average 5,900 people each month. And the enrollees are able to access their medication at any one of approximately 1,600 pharmacies in Maryland that accept Medicaid. So now that you have a little background on what the program does, what this bill seeks to do is bring Maryland into compliance with Federal Health Resource and Services Administration regulations regarding maximizing revenue to the program prior to requesting federal funds. During an August 2020 Office of Legislative Audits review of the Department Pharmacy Services, it was revealed that MADAP was not receiving interest earned on the MADAP rebate funds. And so Senate Bill 186 seeks to correct this finding. There was one amendment to the bill, and that was based on feedback from the State Treasurer's Office, and it simply establishes in statute a special non-lapsing fund for MADAP. The program predated the practice of establishing funds, and so it never had a special non-lapsing fund specifically, even though it operated as if it did. And so the amendment just corrects that oversight and provides statutory consistency with this fund and other special funds in Maryland law. Senate Bill 186 was passed unanimously in the Senate, so the department respectfully requests a favorable report in the House as well. Thank you.
You're welcome. And you have also Mr. Peter DiMartino.
Thank you so much. Yes, I'm just here to represent the program in case there are any questions.
Thank you for being with us. We appreciate it. So are there any questions from the committee members? Seeing none, thank you so much for being with us. Oh, actually, there is a question. Delegate Robin Lewis.
Thank you, Madam Chair. It just took me a moment to find that reaction.
It's okay.
Thank you so much to the panelists. Looking for the Ms. Scheck. Thank you so much. I have a quick question about MADAP because recently a constituent of mine who depends on the services offered by MADAP had experienced an interruption in services. And I'm just wondering, in terms of this bill and how it will essentially ensure funding for the effective operation of MADAP, I'm just wondering whether the funds and this bringing into alignment with federal guidelines, if it will improve the performance of the agency, because I think there's some constituent concerns about responsiveness, problem solving, customer service.
Sure. Thank you so much for that question, Delegate. And so certainly the additional money, the ability to earn interest on these funds will certainly help with that. Although the bill doesn't specifically speak to customer service, I do know that within the past 2 weeks, we had a large stakeholder meeting with several of the constituents and stakeholders involved in this program, and we've set forth a plan on how to address some of the additional concerns that have come up. And so I'm happy to share with you the information that was shared with that stakeholder group. And Delegate Resnick participated as well. I know he's not on this committee, but he was also participating in it. So I'm happy to send that information to you.
Thank you, Ms. Scheck. Madam
Sure.
Chair, would it be all right to share that with the whole committee in case others also need it?
Absolutely.
Okay, I'll look forward to that. Thank you, Madam Scheck. Madam Chair.
So Heather, if you could send it to the whole committee, that would be great.
Absolutely.
Thank you. Any other questions? Seeing none, thank you so much. This really concludes the bill hearing on Senate Bill 186. Thank you for being with us. Next, we have Senate Bill 168, Department of Health Immunet and Statewide Advisory Commission on Immunizations. And again, I believe we have Heather. Do we have Ms. Scheck?
Thank
Okay,
you.
great.
So good afternoon again, Chair Pendergrass, Vice Chair Pena, committee members. Again, for the record, Heather Scheck, Director of Governmental Affairs at the Maryland Department of Health. Thank you for this opportunity to testify in support of Senate Bill 168, which is one of our departmentals. And this bill does two important things. The first is it will remove a carve out in the existing law that exempts healthcare providers who administer vaccines in nursing facilities, assisted living programs, continuing care retirement communities, or medical daycare programs from reporting to Immunet. The COVID-19 pandemic showed that these facilities have the capacity to provide the data on an ongoing basis to the Immunet platform. And, these healthcare professionals are providing care to some of our most vulnerable residents. So we think it's important that they provide this information and data to Immunet. The data provided will be, as I said, by healthcare providers who administer vaccines in those long-term care facilities. And this information, especially over the past 2.5 years, has really been invaluable in the fight against COVID-19. And so the bill just seeks to continue that data reporting. And the second thing the bill does is just it modifies the members of the Statewide Advisory Commission on Immunizations, and it institutes term limits of 4 years for several of them. There was an amendment in the Senate to add 2 additional members to the board. I think that was in response to some stakeholder feedback and friendly amendments. The department doesn't have any concerns with those. So the bill as amended passed the Senate with a vote of 43-2. And so the department would respectfully request that the House return a favorable report as well. Thank you.
And I would imagine that Mr. De Martino is here just for questions, correct?
He may have dropped off, but he can certainly answer any questions.
Okay.
Yes.
So we have questions. We have our first, Delegate Kaiser.
Madam Chair, thank you. I think my question should be relatively quick for Ms. Scheck. Who are the professionals who are doing those immunizations in the nursing homes?
They can range anywhere from the registered nurses. Some long-term care facilities have pharmacists right on site that were allowed to administer the vaccines. So it's any healthcare professional who was allowed to administer a vaccine under the executive order or under their professional licensing.
And then for just a quick follow-up, maybe it's too obvious what I'm asking, but was it ever any EMS personnel doing this in the nursing homes?
I believe under the state of emergency, EMS were allowed to, so they would, if they were doing that, yes, they would have been covered.
Okay, thank you.
Sure.
Thank you. We have Delegate Kelly next.
You, Madam Chairman. Also, really simple question. First of all, really love this bill. Thank you. The carve out for long-term care facilities has always bothered me. I think I just wanted to know sort of is what happened process-wise that we learned under the state of emergency that they were capable of doing this. And so now we can make this change.
Yes, yeah,
Thank you so much.
sure.
Thank you so much. Any other questions for Heather? Okay, seeing none, this actually concludes the bill hearing on Senate Bill 168. Next, we have Senate Bill 196, Maryland Department of Health Overdose Report. And we have our first, it's actually Ms. Check again.
This one should be Robin Rickard of the OOCC.
Okay.
Good afternoon.
Good afternoon, Ms.
Chair
Ricker. How are you?
I'm good. Nice to see you again.
Nice to be seen. Go
So
ahead.
Good afternoon, everyone, and respected members of the committee. Thank you for the opportunity to speak today. It's an honor to be before you again. My name is Robin Rickard, Executive Director of Maryland's Opioid Operational Command Center. And on behalf of the OOCC, I would like to voice our support for Senate Bill 196, the Maryland Department of Health Overdose Report. And you also have my written testimony. This bill will extend the sunset date that requires that the Maryland Department of Health to submit an annual report regarding overdose risk factors by 2 years. We refer to the report as the Data-Informed Overdose Risk Mitigation DORM initiative. DORM, which was initiated following the passage of Chapter 211 Act of 2018, entails creating risk profiles by linking overdose death records to various systems level data sets. Through better understanding who's at risk for overdose, we're able to identify and direct resources to critical areas and to better calibrate programs aimed at reducing overdose mortality. This work has been vitally important for informing statewide policy and strategy. It's helped to identify opportunities for new programs and interventions that can help reduce overdose risk, such as highlighting the need to expand case management services for individuals who have experienced a non-fatal overdose, a population with a much higher likelihood of suffering a fatal overdose. And at a time when the state and the country is experiencing historic fatal overdose rates, actionable information regarding populations at the greatest risk for overdose can help save lives. While MDH was initially able to make progress on the initiative, resource challenges and complications related to COVID-19 created some delays. And in recognition of the need to prioritize this work, the governor's office tasked the OOCC with overseeing the initiative last year. In close partnership with the Behavioral Health Administration, we've made substantial progress in instituting a robust programmatic framework to support DORM. We're also working with several state departments to incorporate new data sets into the project, which will further strengthen the analysis. Extending the mandate for this report will allow MDH to finish implementing the necessary infrastructure to sustain the DORM initiative for years to come. And with that, I urge a favorable report. And thank you so very much for having me here today.
Thank you for being with us. Are there any questions for this witness? Okay, seeing none. I will now call on Mr. DePaul Nibber.
Thank you, Madam Vice Chair. Madam Chair and members of the committee, my name is DePaul Nibber, representing the Maryland Association of Counties in support of SB 196. As you heard from Executive Director Rickard, we are experiencing an unprecedented crisis with respect to the opioid epidemic. We have reached record levels both last year and the year before for opioid overdoses. And so with that in mind, I want to point to how critical the DORM initiative has been with respect to identifying the causes of these kinds of spikes that we've seen, and also identifying effective measures to combat them. As opposed to the more common overdose report, most of us have seen that simply reports out numbers from the medical examiner's office. This report assists with identifying macro level trends. It centralizes a number of relevant data sets related to everything from criminal justice to Medicaid to hospital admissions. Altogether, it's an incredibly useful tool to identify strengths and weaknesses in county opioid response, something that is increasingly needed given the current state of affairs, as well as the influx of settlement money we'll soon be receiving. For this reason, we hope this committee will see fit to extend the sunset on the DORM initiative and urge a favorable report on SB 196. Thank you.
Thank you. So collecting the data is really useful, isn't it, in order to improve the public health? Am I right?
Absolutely.
Thank you.
Yeah.
Any questions for this panel? Delegate Collison? You're muted.
Thank you. I just was wondering about the kinds of data that's being collected. I mean, I absolutely support this notion, but in terms of, I mean, I think Mr. Nibber, you just suggested that the actual numbers are not helpful. So what are the other kinds of data that are being gathered to help us, determine who's at higher risk, et cetera? And I don't know if this is Mr. Nibber or Ms. Ricard.
I apologize if I gave the impression that this is not useful data that we're receiving. We absolutely, this is critical data that we're getting.
Yeah.
Hospital admissions data is incredibly useful, and I believe that's collected from HSCRC. There's data included there with respect to Medicaid beneficiaries, and we get information on what kind of services are being utilized there, what kind of criminal sentencing some of these folks are receiving. I mean, it runs the gamut in this report. It's incredibly useful. And as a former member of the Baltimore City Health Department, it's something that I regularly consulted with respect to looking at policy initiatives that we could take on to combat the opioid epidemic.
Thank you. That's exactly what I was hoping you'd say. Thanks.
When was the last report done?
I can answer that if that's okay. One was submitted last June, and another one will be coming out. And I believe I might have, when I was testifying for the opioid restitution fund, I might have sent it to this committee.
You sent one of us. Is that the last one that you sent? The one for June? You sent
Yes,
that a little while ago. Okay, wonderful.
Yes.
And the next one
I
is
can
coming
send
out
it
when?
again.
When is it coming out?
I believe it will probably come out later this year. I will double check,
Okay.
but we'll keep you up to
Okay.
date, because it does. That's part of the legislation that we need to keep sending it to.
Thank you. We appreciate it. Delegate Kaiser.
Thank you, Madam Chair, and Ms. Ricard, or maybe Mr. Nibber. In terms of the data collection and the data analysis, is there enough staff to do that? Both the collection and some good data analysis?
I can answer that as well. The OOCC, our staff is working on it. There's members of the Behavioral Health Administration, and we are looking to hire a potential vendor to help in this initiative as well, because if you haven't read the report, it is very informative. We have PDMP data, Medicaid, MIMS, suitors, and some of the analysis is very informative as to who's at risk.
Thank you.
Any other questions? All right, seeing none, thank you so much for being with us today. We really appreciate your work and the information you provided to the committee. This concludes the bill hearing on Senate Bill 196. Next, we have Senate Bill 174, Mortality and Quality Review Committee Duties, Reports, and Data Sunset Extension. And that is Senate Bill 174, and we do have Ms. Heather Check.
Thank you, Vice Chair Pena-Melenik. Good afternoon again to yourself, Chair Pendergrass, and the committee. For the record, my name is Heather Scheck, Director of Governmental Affairs at the Department of Health, the State Department of Health. Thank you for the opportunity to testify in support of Senate Bill 174. This bill seeks to extend the sunset of the Mortality and Quality Review Committee, or the MQRC, for an additional 10 years until December 21st of 2032. The MQRC is just one link in the process of reviewing deaths and reportable incidents in the programs and facilities licensed or operated by the Department of Developmental Disabilities Administration and the Behavioral Health Administration. The primary goal is to identify patterns and systematic problems within DDA and BHA, provider community, and to make recommendations regarding actions that will prevent avoidable injuries and deaths and to improve the overall quality of care. The MQRC reviews all deaths and reportable incidents at state residential centers, forensic residential centers, and community-based agencies licensed by DDA. And the purpose is to protect individuals from harm and to enhance the quality of services provided to them. The committee also reviews deaths occurring in inpatient or residential treatment settings, residential crisis services, group homes, including assisted livings, residential rehabilitation program, personal support services, shared living services, and psychiatric rehabilitation programs licensed by the Behavioral Health Administration. If there is a death of an individual in any one of those programs and the person is not in hospice care, it must be reported. And so once it gets reported, the department's Office of Healthcare Quality completes its review or investigation, and then the case is presented to the MQRC, which completes its review. And so MQRC then uses this information and data gathered during these investigations to make those recommendations regarding actions to prevent avoidable injuries and deaths, and again, to improve the quality of care. So as you can see, this committee is doing really important work that provides super valuable information, data, and recommendations related to the safety and quality of care for Marylanders. The bill has no fiscal impact, and it simply extends the committee's authority for 10 years. It did pass unanimously in the Senate, and the department would respectfully request a favorable report in the House as well. Thank you.
You're welcome. Why 10 years?
I think the 10 years is what we normally request for sunset reviews. I think it's just standard.
Okay. Thank you. And are there any questions from the committee? Okay, seeing none. This actually, I don't think there's 1 second. That's it. This will conclude the bill hearing on Senate Bill 174. Next, we have Senate Bill 183, State Government Information Technology Review of Projects and Proposals. And we have, for that one, we actually have Mr. Lance Shine. Is that correct?
Yes, that's correct.
Yes. Will you be so kind and get started? You have 5 minutes.
Good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. I am Lance Shine, Deputy Secretary of the Maryland Department of Information Technology. Thank you for giving me the opportunity to provide this testimony to your committee. The Department of Information Technology supports Senate Bill 183. This bill would require state agencies to notify the Secretary of any proposals regarding the sale, lease, exchange, or other disposition of communications, sites, facilities, or frequencies. Under the current law, any funds from such activities are already required to be deposited into the Major Information Technology Development Project Fund, which the Secretary of DO-IT oversees. The Major Information Technology Development Project Fund is crucial to the continued upgrading of information technology and communications systems throughout the state. In FY 2021, DO-IT is estimated to have 53 MITDPs across 25 agencies. Approval of SB 183 would simply clarify that units of state government are required to advise the Secretary of any proposals regarding the sale, lease, exchange, or other disposition of communications, sites, facilities, or frequencies. For these reasons, the Maryland Department of Information Technology respectfully requests a favorable report on Senate Bill 183. Thank you so much.
I think you're the only witness on this bill. So that being said, are there any questions regarding this bill? First, we're going to start with Delegate Collison.
And I'll remember to unmute myself, Madam Chair. Thank you.
Thank you.
Thank you, Mr. Shine, for being here. So I just want to make sure that I understand any state agency who's going to be making a change in their technological communications will now, under this bill, would be required to report to do it. Is this an approval process or is it just a reporting process? And I'm wondering if it's an approval process, how it ties into some of the cybersecurity bills that we're looking at now. So if you can help me understand what's hard for me to understand sometimes.
I believe it's for situational awareness, but what it allows us to do is if there is an issue, then we can engage because we'll be aware of what's being requested.
May I follow up, Madam Chair?
Yes.
So by engage, does that mean you'll be able to advise them not to do things which may not be helpful ultimately to them, but they could still go ahead with it if they so choose?
Well, as you know, DO-IT sets IT policy and our state CISO reports to the Secretary of DO-IT and he sets security policy. So if something's being done that doesn't follow our guidelines and our policy, then we will take necessary action to inform the administration and the agency or entity that they're not following policy. I'd have to ask our legal folks if there's any other sort of legal or other sort of policing sort of activities we could take to stop it. But I believe we only set policy, and we would just make it aware to the appropriate folks that something's not being done, not following our security policy or not following our IT policy.
Thank you very much. Thank you, Madam Chair.
My pleasure. Are there any other questions for Mr. Shine? Seeing none, thank you for being with us today, sir. We really appreciate your testimony and your work. This will conclude the bill hearing on Senate Bill 183. Next, we have Senate Bill 192, State Procurement Minority Business Enterprise Program Reauthorization Extension. And that will be Mr. Earl Lewis.
Good afternoon, Chair Pendergrass, Vice Chair Pena-Milnick, and distinguished members of the committee. For the record, I'm Earl Lewis, Deputy Secretary of the Maryland Department of Transportation. Thank you for allowing me the opportunity today to speak in support of Senate Bill 192, which provides for the continuation of the state's Minority Business Enterprise Program and extends the due date of the Disparity Study report that provides the legal basis for the program's implementation. By way of background, Maryland's MBE program was established in 1978 to ensure that small, minority, and women-owned businesses had the opportunity to participate fully in state procurement activity. The MBE statute currently provides the program will terminate on July 1st, 2022. Prior to each periodic reauthorization and to ensure that the MBE program remains constitutional, the state periodically commissions a disparity study to evaluate the continued compliance of the MBE program with the requirements of the Crozon decision and any subsequent federal or constitutional requirements. Maryland uses a study not only to provide the evidentiary basis for the MBA program, but also as the evidence to support all the state's minority business initiatives, including, for example, application of the MBE program to video lottery terminal facilities and public-private partnerships. The study examines whether there is continued discrimination against minorities and women in the Maryland market by evaluating disparities in state contracting data, generally referred to as the public sector data, as well as disparities in wages, business owner earnings, access to credit, and business formation rates, generally referred to as private sector data. Pursuant to 2017 legislation, the disparity study has been initiated by MDOT, the state's MBE program certification agency. Due to complexities of the procurement for the consultant and unforeseen circumstances, completion of the study has been delayed, and we're anticipating that the report will now be submitted to the Legislative Policy Committee in September 2023. Senate Bill 192 also includes concurrent extension of the MBE program sunset date so that the program can continue while the study and report are finalized. For these reasons, I respectfully request the committee grant Senate Bill 192 a favorable report. Thank you.
Thank you for your testimony, Mr. Lewis. Are there any questions for Mr. Lewis regarding Senate Bill 192? Seeing none, this will conclude the bill hearing on Senate Bill 192. Thank you for being with us today, Mr. Lewis, and for your work. Next, we have the last bill of the day, which is Senate Bill 144, Senator Feldman, Health Authorization to Prescribe and Administer Amygdalin repealed. Good afternoon.
Good afternoon, Chair Pendergrass, Vice Chair Pena-Melnick, and honorable members of the Health and Government Operations Committee. My name is Frederica Struess, and I'm here on behalf of Senator Feldman, who sends his regrets. He intended to be here personally, but at the last minute was unable to break away from the cannabis hearings that are being heard in finance today. So therefore, I'm here to present Senate Bill 144, authorization to prescribe and administer amygdalin repeal. And this is for your consideration today. So decades ago, starting in the 1950s, there was a drug called amygdalin, also known as Laetrile, that was widely used in cancer treatment. However, by the 1970s, the FDA concluded that there was no evidence whatsoever to indicate that the treatment was effective, and therefore interstate shipment of the drug was banned by the FDA. Not only was amygdalin not affected, it was not effective in treating cancer. According to NIH, there was harmful side effects that included nausea, vomiting, headaches, dizziness, liver damage, hypotension, fever, and mental confusion. The American Chemical Society called it a potent poison. For reasons that remain unclear, the drug is still on the books and remains legal in Maryland. Given this information, it's not surprising that amygdalin is banned by the FDA, and they have a policy of pursuing charges against medical professionals who prescribe the drug in any state. Senate Bill 144 will put Maryland in line with 30 other states and FDA policy by repealing the subsection of the Maryland Code that permits physicians to prescribe and hospitals to administer amygdalin to treat cancer. MedChi and the Maryland DC Society of Clinical Oncology have submitted written testimony to this committee in support of Senate Bill 144. There was no opposition to the bill in this Finance Committee, and it passed through the Senate unanimously. Therefore, Senator Feldman respectfully requests a favorable report for Senate Bill 144. Thank you.
Thank you for being with us today. Are there any questions for this witness? Okay, seeing none, thank you so much. Tell him that you did an amazing job.
Thank you.
Thank you for being
Have a nice
with
day.
us. You have a great day. This will conclude our bill hearings for today. I hope you have an amazing and blessed afternoon. Thank you.